Radio Menopause. Lifestyle, health, nutrition. Today I'm talking about the link between thyroid function and menopause. Thyroid diseases predominantly affect women. Their incidence is between 5 and 20 times higher in women than in men. Does menopause cause thyroid disorders? It has been documented that estrogen levels can have both indirect and direct effects on thyroid function. But the connection between the two has been an ongoing debate, as studies show that thyroid function reduces naturally as we age, and also because symptoms of menopause and hypothyroidism overlap. The thyroid is a small butterfly-shaped gland located in the neck, and it produces hormones that regulate our metabolism, energy levels, and body temperature. The thyroid gland can sometimes become underactive, this is called hypothyroidism, or overactive, which is called hyperthyroidism. Hyperthyroidism is less common and speeds up metabolism to much more than what is needed. This can cause fatigue, sweating, heart palpitations, anxiety, insomnia, and more symptoms. Hyperthyroidism is usually managed by a specialist using medications or surgery. Hypothyroidism happens when the body is making too little thyroid hormone, which slows down the body's metabolism. This can cause fatigue, weight gain, mood changes, dry skin, changes in libido, and forgetfulness. According to the British Thyroid Foundation, it is common for perimenopausal women to have an underactive thyroid. Studies show that up to 20% of women over the age of 60 might also have an underactive thyroid. Hypothyroidism is managed by doctors in practice using medication like levothyroxine, which replaces what the body is not naturally producing. Have you noticed how similar symptoms from thyroid disorders are to menopausal symptoms? So, a woman who starts to experience menopause symptoms, especially under the age of 45, should not simply assume it's perimenopause. Make an appointment with your doctor for some blood tests, as these are a powerful tool that can determine the source of your symptoms. Some women are in perimenopause in addition to having thyroid problems. The combination of decreasing estrogen with thyroid disorders increases the risk of osteoporosis and cardiovascular problems even further. So it's important to check your thyroid levels at least once a year. Having a thyroid problem can make menopause symptoms worse, but if a thyroid disorder is treated and kept in check, there should be no effect on menopause symptoms. HRT does not change normal thyroid function. Women on medication for an underactive thyroid might need their doses adjusted ever so often if they take oral HRT. Patches or gels do not have a similar effect. So here are some tips to look after your thyroid health. We advise caution with supplements, as we have to keep in mind that hypothyroidism and hyperthyroidism are completely opposite problems. So the treatment for each condition is very different. Discuss with your doctor the possibility of testing your bloods for iodine, selenium, and zinc, as many cases of hypothyroidism are lacking in these elements. You can look after your thyroid and address any deficiencies by aiming to eat a balanced diet that includes probiotics while reducing processed foods. Relieving stress by exercising, getting enough sleep, and self-care activities reduces adrenaline and cortisol, which are known to have a negative effect on thyroid. I hope this podcast has helped you understand any connections between thyroid and menopause. Thanks so much for listening to this episode of Radio Menopause. Make sure you get every episode by hitting the subscribe or follow button on the podcast. I will see you here next time. Goodbye.